right, so this next mnemonic is to help you remember the questions that you need to ask when you're fully assessing someone's pain. So it's really important that when you're assessing pain, you don't just ask, are you in pain, yes or no? Can you rate it on a scale of 1 to 10? And all you know is, yes, I'm in pain, and there are 6. Well, that really doesn't tell you a whole bunch. So it's really important to know very specific things about their pain, so you not only know how to treat it appropriately, but you also know, hey, is this a new situation? Is this different? Because they might not always communicate to you when they're having this different kind of pain. They may just be answering your question and not really connect the dots, even though it may be kind of obvious. So it's really our position as the caregiver to ask the appropriate questions. So pain assessment questions. So the mnemonic is OPQRST. So it's just your alphabet. And I just kind of remember that it's the letters around P for pain. So OPQRST. The O stands for onset. When did this start? Was this 2 minutes before you hit the call bell? Or has this been going on for hours? Or is this a chronic situation? So O is onset. P is for provoke. So what started this? Is this something that, like I said, is chronic? Or did you get up to go to the bathroom and since then your hip has really been killing you? Or did nothing provoke it and all of a sudden you have some pain? So that's your P, provoke. The Q is for quality. And another kind of way to remember what quality means is it's what's the character of the pain? Dull, sharp, aching, burning, that kind of stuff. Tell me about how, not just that you're in pain, but what does this pain feel like? It's really important to know quality, especially when you're talking about things like chest pain and whatnot. We got to know what kind of quality it is. The R is for region. Where is this hurting? Or another R is radiation. Is it starting one place and then radiating to another place? So is this, your right lower quadrant of your abdomen? Is this your head? Where on your head? That kind of stuff. So where is this hurting? Region. The S is signs, severity, and symptoms. So how bad is this? Are we in emergency mode where we're 8 out of 10 crying, 9 out of 10 almost unable to communicate? We're in so much pain. Are there any other symptoms that are involved with this? Are they having nausea? That's a big thing that accompanies pain, nausea. Is this pain setting off other pain? Is this pain eliciting anxiety? Those kind of things. So that's your S for signs, severity, and symptoms. And another aspect of signs is did you start getting some signs before this was getting really bad? So, maybe it was a little bit of a dull ache and now all of a sudden it's severe. So that's something to know. Signs, severity, and symptoms. And then your T is time of onset, duration, and intensity. So time of onset is a little different. So did this start at 2 p.m.? Or did this start months ago, and is it continuing? What is the duration actually? Is this the first time this has happened? And what time was that? So I can quantify in my mind how long this pain is occurring. Because if you got somebody who's had chronic pain and you're trying to address it, we have to have realistic goals and understandings of how we're going to deal with this pain. Because if you have someone that's coming in with this horrific chronic pain, it might not be realistic to expect that your Norco that you're going to give them is going to address it, So it's really important to understand the time of onset, duration, how long it's been going on, and the intensity. So maybe did this start at 9 a.m., and it's now 5 p.m. and it's been going on all day and it's been increasing in intensity? Or is it increasing and going away, increasing, going away? We need to know, is this a consistent increasing, ascending pain, or are we getting some ascension, descension, that kind of thing going on? So your OPQRST is your mnemonic. Onset, provoke, quality, region, signs, severity, and symptoms, and time of onset, duration, and intensity. So those are things you really want to remember as you're assessing pain as a nurse.
This has been another episode of the Nursing Mnemonics podcast by NRSNG.com with your host, Katie Kleber, RN, CCRN. To grab all of our nursing cheat sheets, head over to NRSNG.com/freebies. That's NRSNG.com/freebies. Thank you so much for being here today. We love you guys. We thank you so much. We want to see you guys succeed. Listen, we're all in this together. Now go out and be your best self today. Happy nursing.